All right, we're going to go ahead and get started this evening. Good evening, everybody. My name is Pat Kane, Public Programs Manager in the Museum and Education Department at the Champaign County Forest Preserve District. And I want to thank you again for joining us this evening as we continue a special speaker series virtually. And in just a few short moments, I will bring on Julie Pryde to present tonight's program, History of the Champaign-Urbana Public Health District. Before we get into tonight's program, I did want to go over a few housekeeping items, promote some upcoming programs, and say some thank yous. So tonight, we're unable to have an on-screen American Sign Language interpreter as we've had for some of our recent programs. I'd like to apologize for that. However, they're not perfect, but I would welcome you to toggle the automatic closed captions on for tonight if you wish. Again, they're not going to be the most perfect narration of tonight's program, but you can do that on Facebook or YouTube, wherever you may be watching tonight. I'll work to have an ASL interpreter for our next virtual program. Museum of Grand Prairie, if you've never heard about us, opened originally in 1968 as the Early American Museum, and our current mission is to collect, preserve, and interpret the cultural and natural history of Champaign County and East Central Illinois for all generations. We're part of the Champaign County Forest Preserve District, which is a collection of 7 forest preserves here in Champaign County and East Central Illinois. Also includes educational facilities such as the Museum of the Grand Prairie and the Homer Lake Interpretive Center, multi-purpose Kickapoo Rail Trail, and Lake of the Woods Golf Course, and so much more. So check out Champaign County Forest Preserve District if you're local here in East Central Illinois. In fulfillment of our district's mission to protect Champaign County's natural and cultural resources and inspire people to care for, enjoy, and explore their natural world, the Champaign County Forest Preserve District recognizes its responsibility to acknowledge those Native peoples who came before us on this land. We currently work to preserve and tell the story of the lands of the Peoria, Kaskaskia, Wea, Miami, Kickapoo, and Potawatomi nations. Native Americans shape the landscape that the Forest Preserve District sits within, and we must recognize that the forest preserves occupy the ancestral, traditional, and contemporary lands of the people as previously mentioned, and that they were the first stewards of the land. It's necessary for us to acknowledge these Native nations, to work with them, and to continue to steward land and educate the public with honor and respect. CCFPD will work to be inclusive of all differences and keep Native peoples and their history at the core of our efforts. This program tonight is one of many programs, as I mentioned before, in a special speaker series, and it began earlier this summer when we opened up our newest exhibit at the Museum of the Grand Prairie titled A History of Healing, Infectious Diseases and Community Responses to Defeat Them. The exhibit focuses on the local and worldwide impact of such diseases as the 1918 flu, smallpox, malaria, tuberculosis, polio, typhoid, cholera, HIV, AIDS, and COVID-19. In addition to examining the impact disease has had on our health and well-being, the exhibit highlights particular instances in the past as well as the present where local citizens came together during previous epidemics and pandemics for the betterment of their communities. We encourage all to come visit this special exhibit at our museum, where our current fall hours have the museum open every day from 1 to 5 p.m. And as always, admission to the museum is free. I did want to let you know about some upcoming programs in the series and some things happening at the museum. Our next program in the series will stream much like tonight's program on our Facebook and YouTube pages at 7 o'clock on Thursday, September 29th, 1 week from tonight, where Dr. Natalie Lira, Assistant Professor of Latino Studies at the University of Illinois Urbana-Champaign, will present the program titled They Never Ask You, They Just Tell You After It's Done, a program about sterilization abuse and histories of resistance. The following night, on Friday, September 30th, at the museum, we will be hosting an unveiling of our Healing Hearts Collage, which has been a community art collection where we collected art over the course of the summer or pieces that represented various pandemics that are currently that we're currently facing here in Central Illinois. So greatly appreciated the public's response to that, and we had local artist Cindy Sampson put together a collage that we'll be unveiling at the museum that night. And that will happen from 5:30 to 7 o'clock at the Museum of the Grand Prairie in Mahomet, Illinois, that opening of the Collage. Another program in the virtual series on Wednesday, October 5th at 7 p.m. on our Facebook and YouTube pages. Gina Roxas, a citizen of the Prairie Band Potawatomi Nation and program director for Trickster Cultural Center in Schaumburg, Illinois, will present the program titled Healing Plants, Native American Connections to Nature for Health and Healing. And then one last program to promote in the series on Tuesday, October 18th, Dr. Lynn Curry, Professor Emerita of History at Eastern Illinois University, will present the program titled Kids and Germs, Child Health Reform in the Early 20th Century. For updates on those programs and more info on all programs within the series, as well as what's happening throughout the museum and Forest Preserve District, I encourage you to find us on social media or visit museumofthegrandprairie.org. As I have in the banner at the bottom of the screen, always love to see where folks are tuning in from. So let us know where you're watching from by typing that down in the comment section below. We have Susan, who's chimed in watching from northern Michigan. So let us know where you're tuning in from tonight, whether you're watching this live or potentially watching it recorded. Love to see where folks are tuning in from. Also, should you have any questions over the course of tonight's program, put those down in the comment section, and we'll have a short Q&A at the end of the program. Okay, enough of me talking. You guys didn't come here to hear me talk the entire night. So we're going to jump into tonight's program, and I'm going to bring on our presenter for this evening's program, Julie Pryde. Hey, Julie, how you doing?
Good. How are you?
I'm well. Thank you. Thank you so much for joining us tonight, presenting tonight. Also wanted to thank Julie. Julie has been a big supporter and a huge help with our exhibit, A History of Healing, that I mentioned that we opened over the course of the summer. So really appreciate the support of local public health department and Julie and her team in putting on that exhibit, and as well as a number of other things and ways that we've linked up over the last couple of years. So I'm going to introduce Julie, and then Julie, I will turn the show over to you. So Julie A. Pryde is a licensed social worker and a certified public health administrator. She serves as public health administrator of Champaign-Urbana Public Health District, CUPHD, and a nationally accredited health department. Ms. Pryde earned her Master's of Social Work from the University of Illinois Urbana-Champaign and her Master's of Public Health from the University of Illinois Springfield. Additionally, she has participated in Mid-America Public Health Leadership Institute at the University of Illinois Chicago, Epidemiology in Action course through Emory University and the CDC, and the Kresge Foundation's Emerging Leaders in Public Health cohort. She has been published in professional journals and presented at national conferences on topics related to public health. Ms. Pryde began her career at CUPHD in 1995, working with the HIV/AIDS program. She served as the director of the Division of Infectious Disease Prevention and Management at CUPHD until 2007, when she was appointed as public health administrator. Ms. Pryde serves in advisory roles to the UIUC School of Social Work, UIUC College of Agriculture, Consumer and Environmental Sciences, College of ACES, and the YMCA's New American Welcome Center. So without further ado, let's give a warm virtual welcome to Julie Pryde. Thank you, Julie.
Thank you. I'm very happy to be here tonight and give you a little overview of what it is that we do at Public Health. Okay. Oops, is my little thing not moving? There we go. The mission of Champaign-Urbana Public Health District is to improve the health, safety, and well-being of the community through prevention, education, collaboration, and regulation. We have been around since 1937 here in Champaign. We're one of the oldest ones in Illinois, and we are also a public health district as opposed to a public health department. So we're not a county health department, but we are one of 3 districts in the state. So what is public health? For people who don't know what public health is, and there are a lot of them, probably fewer now that COVID has happened, but we do a lot of things. when you eat or drink, you take the safety and of your food and water for granted, which is not always the case when we travel to other locations in the world. But this is because of public health laws, longstanding public health laws in the U.S., and the inspectors are doing thousands of inspections each year. When there's in Champaign County, when there's a birth or death in someone's family, I am actually the registrar, and I will sign the birth and death certificates, as some people may have noticed. And then we, of course, keep track of that data and get it to the state. When you need confidential STD or HIV testing, you can come to our clinic to get tested and treated. This was traditionally started at public health departments because back when there was a lot more stigma associated with sexually transmitted diseases, and certainly with HIV in the beginning, we needed to have places where people could feel more comfortable coming without having a face-to-face sometimes with their own doctor. When you have questions, concerns about the environment, about bed bugs, mosquitoes, zombie apocalypse, anything that affects humans, animals, or the environment, you can call public health. If we don't know it, we can connect you with someone who does. So what we are not at Champaign-Urbana Public Health District, we are not public medicine. So public health is not public medicine. Our federally qualified health center in Champaign we have two actually. We have Francis Nelson Health Center, also known as Promise, and we have the Community Health Partnership, which is located in our building as well. We are not a convenient care. So if you injure yourself or you have a sore throat or you don't feel well, you don't come here for that. You go to one of the other places in town, Carl, Christie, OSF, Francis Nelson. And we are not a social service agency, although we certainly do have programs that are much like social services, and we connect really closely with lots of programs here in the community. We're also not a free clinic, and although a lot of the services that we provide are at no cost to individuals, they're not primary care services. So we have Avicenna Health Center, which is actually located in the east wing of our building here, and Champaign County Christian Health Center are two examples of free clinics. So this is what Champaign-Urbana Public Health District was started to do in 1937. So the main goals to start public health back then were venereal disease control. I don't know who's on this presentation, but I recently talked to medical students at the U of I and found out that they had never heard of venereal disease. So that's how old I am. That is actually sexually transmitted diseases or sexually transmitted infections. Also started for milk inspections, because back then there was no milk inspection. There was no way for people to know if the food or the milk that they were getting had anything in it, any pathogens that could cause tuberculosis or enteric pathogens or make them sick. So that's how it all began here. And while I really would love to know the history of how that started, I don't have it, and I would love to know. What I do know is it was started by a group of concerned women in the community. So, maybe the Museum of the Grand Prairie can find that out for us at some point. The other reason why we don't have a lot of things around that we would normally hope to have is that public health suffered a fire in, I believe it was around 1982, and that they lost their facility and a lot of the stuff in it. This is the first public health department you can see here, and then we have been in numerous buildings in the community since then. So this is kind of what we do. Well, it is what we do now. These are the services that we do, and they are for all. In wellness and health promotion, we have a children and teen dental clinic. We do school sealants, tobacco education, sexual health education. I mentioned vital records, maternal and child health. We have the WIC program, which a lot of people know about. We do lots and lots of childhood immunizations, lead screenings. Teen and Adult Services, which used to also be called the Division of Infectious Disease. They have HIV counseling and testing, family planning services, communicable disease surveillance, Narcan. We can train people on and provide them with Narcan so that they can prevent an overdose. And then environmental health, that does the things, the restaurant inspections, private sewage and well permits. We do radon testing. They have the West Nile virus surveillance project and mitigation. So they go and they ride around on bicycles and drop larvicidal briquettes into storm basins all over, or storm sewer basins all over Champaign-Urbana and Savoy. So that is kind of where we are now. And over the years, this has changed drastically because public health, we try never to duplicate services, but we try to come in and do things that are needed, that are not being done. Part of our job is assurance to make sure that things are being done. And so that's why it changes over the years based on which diseases are around, what things are needed. So these are some of the greatest public health achievements in the United States. A lot of people don't realize that these were public health interventions. Public health interventions have saved more lives than medicine combined. And you can see what some of them are. It's vaccination. OSHA sprang out of public health, safer work, safer and healthier food, motor vehicle safety, control of infectious diseases, declines from coronary heart disease and stroke, family planning, recognition of tobacco as a health hazard and all that followed with that, healthier mothers and babies, everything from, initially home nurses visiting homes to talk with mothers and help them out with babies, and then fluoridation of drinking water. So those are really the 10 largest overarching public health achievements. And you can see by looking at these that many of them are now run by much bigger agencies that have the rules and then pass it down sometimes to the local levels to do the actual, work of it. So those are the big things that we do. I'm going to go over some definitions now to tell you, in case I'm using these words in a minute when I talk about some of the diseases that we deal with. I came from the Division of Infectious Disease, so that is always going to be my favorite. I can't help it. I started out in HIV/AIDS, and I am just absolutely fascinated by all of the things that we do in public health. So, okay, when I talk about pathogens, that's going to be any disease-causing organism. So there are 5 main types: viruses, bacteria, fungi, protozoa, and worms or helminths. And so you know that all of those clearly have different strategies that we have to do to look for them and to mitigate them. Endemic means when a pathogen still exists in the community but becomes manageable. So things that started out as pandemics or as epidemics now are endemic, meaning that they're here and that we have outbreaks of them rather than it's just constant like we are seeing with the coronavirus. The current coronavirus, COVID-19, is still a pandemic, despite what you may have heard in the news. It is still a pandemic. And while it's different, it's going to continue transitioning on from the acute pandemic where we had no way to do anything. We were just learning about it. We had nothing but what we call non-pharmaceutical interventions to deal with it. So that's closure, isolation, quarantine. But now we have a lot more tools, which always makes public health happy when there's more to do. Vaccination, there are treatments, and those along with some of the lesser mitigation like wearing masks really can have an impact. An outbreak is something where it is just you have a disease in the community and it is above normal. So that can also be like a mini epidemic, we can call it. So it's anything expected above the norm. So you can imagine that right now with COVID, we're not calling this a COVID outbreak because we've been in high transmission for so long. Monkeypox was an outbreak when we just had it in 2003, and then we had it again, we're still having it. But that is an outbreak because you would expect no monkeypox, and then you have monkeypox. Smallpox, same thing. If we were to see a smallpox case, well, I don't even want to think about that, but one case would be, an outbreak, an epidemic, and cause for much alarm. Whereas with influenza, we can have, hundreds of cases, and depending on where we are in the cycle, it might not be considered even an outbreak. An epidemic is the same type of thing. It's when the disease affects a large number of people within a community or population or region. So there have been lots of examples of epidemics throughout the years. Measles, mumps, rubella. Luckily, a lot of those are vaccine preventable, but we also have things that come around like, well, I can't think of anything right now, but they're diseases that can spring up. They can either emerge or reemerge and cause problems because they're so widespread, but not as widespread as a pandemic, which pandemic means worldwide spread. So spread over multiple continents or countries, we're still having that. So, and then one other thing is reservoirs. So this is places where the pathogens reside. So these can be living or non-living sites. So they can be within a person, for example, like a disease that can stay within a person or an animal, or it could be something where it's in the dirt, it's in the soil, like anthrax or something like that can be that type of thing. Okay, so I'm real quickly going to talk about transmission routes because this is a big part of how we address things. So you have and this is also the reason why there's such a big difference between COVID-19, which of course is airborne and it is extremely infectious, versus something like monkeypox, which, while shocking that came up, we knew that we would be able to get a handle on it because of the way that transmits. And so there's contact transmission, that's person to person. So that's touching, kissing, sex, droplets. Vertical is mother to child. Horizontal is like mucous membranes, droplet. That would be respiratory spread less than 3 meters. And then indirect, or that's something on fomites or like inanimate objects. That's why we tell you to, with certain diseases, we tell you to make sure that you clean commonly touched surfaces because the pathogens can live on surfaces sometimes. Vehicle transmission, that's your foodborne, your waterborne, fine particles, which are aerosolized. So that would be something like hantavirus or TB. So hantavirus is an interesting one. And we actually had an outbreak in our community of sole hantavirus, and it was transmitted through pet rats, but it was transmitted here through like a bite, or it can always be transmitted that way, but it was really transmitted through aerosolized particles. So the rat urine or feces becomes aerosolized either through cleaning cages or cleaning up or through getting on something and going into the air, like in dust or something like that. A vector, we talk about vectors a lot in public health. These are typically the arthropods that carry pathogen from one host to the other. So, disease, some diseases are spread by mosquitoes, ticks, fleas, mites, kissing bugs, biting flies. Certainly in our area, the biggest is mosquitoes. We have mosquitoes that can transmit West Nile virus. We also have mosquitoes that can transmit Zika virus and other things. And then, of course, ticks. Ticks transmit all kinds of things, and they can also transmit certain diseases that we don't typically think of as a tick-borne disease, like tularemia, for example. Animals can be transmission routes, specifically rabies, tularemia, also known as rabbit fever. You can certainly be infected by those. We have cases of rabies in bats all the time. In Illinois, we do surveillance. If someone finds a bat in their home, we like to get a hold of that bat and get it tested, so that can prevent, hopefully, someone from having unnecessary post-exposure prophylaxis. But I will tell you, if you ever wake up in your bedroom or your home, you wake up and there's a bat in your home, you will be, if we can't get a hold of that bat and send it for testing, you will be getting rabies post-exposure prophylaxis. And that's because the bat's bites are so tiny and unnoticeable that often people are bitten without realizing it. That'll make it difficult for some people possibly to sleep tonight. I apologize for that. I do have kind of a weird sense of things that I talk about that don't bother me, but sometimes bother others. And then we also know about healthcare associated infections, and those have been rising over the years. You will hear about, C. diff and some fungal illnesses that are transmitted within healthcare facilities, and other illnesses like that. So in Illinois, I'm going to show the reportable diseases. A lot of times you're not even going to hear about these diseases, but that doesn't mean that we are not seeing cases of them. Sometimes they're imported from another area. Sometimes they're not. But when we get any one of these diseases, we have a whole list of things that we have to do to follow up with them. And when I say reportable diseases, that means that these diseases are mandated, reported to the local health department. Some of them within, immediate, we have to get an immediate call, some of them up to 7 days. So it depends on the potential severity of it and the potential for spread and the unusualness of it and all kinds of things. But we know what those are, and the hospitals and clinics and labs know what those are. And as soon as we get a report of it, then that communicable disease investigators spring into action and we work on it, which I'll show you in a minute. So these are available to look at on the internet too, if you're interested. They are pretty fascinating. So we have the vector vehicle ones, and those are, you can see a lot of those are spread by bugs, by ticks or mosquitoes. Then we have the food and waterborne. When we work with those, we bring in communicable disease division, the environmental health division. Sometimes we have to get state engineering involved. Sometimes we have to get the EPA involved. These are things that are, spreading potentially in our water or food. Because we are on a municipal water system in most of our county, we don't see a lot of this, but people can get it you can also get it sometimes from food. So that's mostly where we would see it. Vaccine preventable diseases. These are ones that, luckily we don't see a lot of that. But we see too much of it. Because they're vaccine preventable, we shouldn't be seeing any of it, or very rare, imported cases. But so you'll see, probably a lot of you don't even realize that you get diphtheria, that you have diphtheria vaccination. In the tetanus shots now is tetanus, we call them tetanus shots still, but it's tetanus, diphtheria, and pertussis are in those. Measles, mumps, rubella are together in a vaccine. We still have polio vaccine, and you can see how when there is a decline in vaccination, that these will rise up again. You can see with polio in New York. I never thought in my career I would see polio popping up because people aren't getting vaccinated for it. And then, of course, there's smallpox, which is vaccine preventable, but it's also been eradicated naturally, not naturally, but naturally occurring smallpox has been eradicated. It is still out there in a couple of labs, and there is always the potential, that is scary, but there's always the potential for, that to be released as either through a bioterror or a bioerror type of event. So smallpox, while we don't typically think of it in, day-to-day world, public health still thinks about it. Then we have the sexually transmitted diseases. We have had new ones since, I've been working in public health. Every once in a while, something strange will happen. And while we don't show monkeypox on here as sexually transmitted, they are still looking at that to see if that is one of the ways that it can be spread. And when I say sexually transmitted, I mean through body fluids, not through contact. So they're still, checking that out. And it may actually become one. We just don't know. And then environmental, Staph aureus, Strep A, these are the things, CRE, these are things that we see sometimes in hospitals or nursing homes, places like that. Okay. Then I'm just showing you real quickly who we work with when we do this. So if we have a vector or vehicle borne, we usually get our communicable disease division here, environmental health. We use the experts over at Vet Med and entomology at the U of I a lot. They're very helpful, and we're very lucky to have them in our community and to be so accessible to us. Of food and waterborne outbreaks, it'll be our CD and EH divisions, and like I said, engineering, EPA sometimes. Vaccine preventable, we use our communicable disease, we use nurses, and then clinic logistics. We have had to do lots of large-scale mass vaccination campaigns. COVID was one, H1N1. We've had Mumps outbreak at the U of I that we've done, Meningitis outbreak. So we have a lot of experience doing those. Sexually transmitted diseases, we use CD staff, but mostly we have STD-specific staff for that. And then environmental health and environmental infection, we would work with a variety of places as well, sometimes even OSHA. I just want to show you some of the pandemics throughout history and to show you where COVID is in that history. You can see that what's known as the Black Death or bubonic plague, that was the big one. So many deaths from that, but it also, went on for several years. It was obviously a completely different time. There weren't a lot of things they could do for it. And it was spread initially by the fleas on the rats, and then it probably became pneumonic at some point during that. You see smallpox smallpox is just the big horror. That's the really scary one. And then you see what you always hear about, the 1919 Spanish flu pandemic, and you can see how many it killed. And it goes all the way down. And down here is the initial little SARS that happened in 2002, 2003. And that is tiny in comparison. That could have taken off. MERS could have taken off. These could have taken off and become much wider pandemics. SARS was the scary one. I think everyone believed that had a good chance, but it was shut down early. Unfortunately, that didn't happen with COVID-19, and it was more transmissible, and it just took off. So you can see how quickly a pandemic can take off from not even knowing about it to that. And I was trying to see in here. Here's the swine flu went in 2009. I don't know why they call it swine flu. I find that very irritating when places refer to it. All flu is basically coming usually from birds or through pigs. That's not uncommon at all. That's how it works. But so this would be down here, your H1N1. And you see, even though that was a pandemic and you saw how fast it happened, you can see it was much less virulent. And we had, the deaths were around 200,000 worldwide. Every time I talk about COVID, I have to update. Unfortunately, I have to keep updating the deaths. We're now at 6.53 million deaths due to this, and 1.05 million of those are in the U.S. alone, which I still have difficulty wrapping my head around. We have had, what did we have in Illinois? 34,935 deaths as of today, and we stand at 306 deaths from COVID in Champaign County, which is, just way, way too many. And it's ongoing. We're still seeing in the U.S., 400 to 500 deaths a day from COVID. So it is not over. It's probably not going to become endemic for, some models showed like 2024, it may become endemic by then. All right, so coronaviruses, I just wanted to show you that, coronaviruses have been out there for a very, very long time. They started out, probably all of these started out as either probably at least epidemics, and they could have, who knows when they originated, but we have the first 4 that you see there are actually coronaviruses that cause what we call the common cold. There is no such thing as a cold. A common cold is a bunch of different viruses. You can either, right now in our community, we have adenoviruses circulating. You can get rhinoviruses, coronaviruses. So there are all kinds out there. And then below that, you see that we saw MERS. Well, SARS actually happened first, and then MERS, which is the Middle East Respiratory Syndrome. And then boom, COVID-19 or SARS-CoV-2, which it's actually referred to. That's what the virus is called. What are some of the things that CUPHD has responded to over the years? We deal with foodborne outbreaks a lot of the time. Norovirus is the most common. That's what people call stomach flu. There is no such thing as stomach flu because flu means influenza. I always like to get that little plug in there. But norovirus is often what's causing that. It's very infectious. You hear about it on cruise ships, and we have outbreaks in the community all the time. Staph, that's a foodborne outbreak you don't want to see. We've had some, I won't get into it, but we've had some community outbreaks long before I was here that were legendary. Salmonella. And a lot of times these are not, these foodborne outbreaks, people think that they're maybe caused by the restaurant or their handling of food at their own home. That used to be much more the case, but now the way we grow some vegetables, and that we've seen this with like romaine lettuce and things, that sometimes and sprouts, and sometimes it's the actual product that's contaminated. It's not contaminated in the setting where it's cooked, but it's contaminated before that. We've had cowpox outbreak here. We had the distinction of being the only human case of cowpox in North America. I won't get into that one. You can always Google it and look in the medical journals if you're interested. Monkeypox. We had monkeypox back in 2003. Hardly anyone seems to remember it, but we did, and it was caused at the time by pet prairie dogs, which I did not know there was a such thing as pet prairie dogs. Sol hantavirus outbreak, which I talked about earlier, was caused by pet rats. I was also not aware of the rat industry, the rat breeders for pets. That was really interesting. Tularemia, we've had that. We've actually had some very serious cases and a death in our community due to that. Tularemia, or rabbit fever, is especially dangerous if you breathe it in. So what happens sometimes is that people can run over a diseased rabbit carcass in their yard and not even know it while they're doing yard work. And that can be aerosolized. And while it's treatable, a lot of times people don't get treated soon enough. West Nile virus, we know about that. HIV, AIDS, COVID, and H1N1 pandemics. Those are the 3 I've worked on in my career, and it better be the last one. Zika, that was another one that just popped up. Ebola. These are all things that we've had to deal with. Ebola, what we did with that is it was a reportable disease, but it was also associated. So if someone had traveled to where the outbreak was and they came back to the U.S., they were followed by public health for the entire incubation period. So we would have to meet with the individuals and have them test their temperature multiple times a day. COVID-19, Mumps, we had a mumps outbreak, which is especially distressing to me as that is a vaccine preventable disease. Hepatitis A, that is usually a foodborne outbreak, and those are very serious. They are very difficult to mitigate because if they are done in something like a large restaurant, one of the ones in Illinois was at a McDonald's over in the Quincy area, and they had to try to locate everyone who had eaten there over a time period. Very difficult. Pertussis or whooping cough, that's made a comeback. We hadn't seen that in years and years and years. TB, we still deal with a lot of tuberculosis, which again, I thought when I started in public health, I thought the TB would probably not be something we would have to deal with, but we deal with it a lot. Meningitis, very scary. There's a vaccine for that now, luckily, but it's a very, very scary illness. And when it breaks out, often it's associated with college campuses or congregate settings. We have to move really quickly to get vaccination and things for that. Smallpox vaccination, we actually have done smallpox vaccination here, where you use the bifurcated needle, you dip it in the vaccine and you stab the arm. It's more of the old school way to do it. Now, we did that after 9/11 when we had to prepare staff in case there was a bioterrorist event with smallpox. And then now people don't know this, but the monkeypox vaccine, it's not really a monkeypox vaccine, it's a smallpox vaccine because they're both orthopox viruses and it works for that. So now we have a smallpox vaccine called Jynneos that is just like a regular vaccine. And we can even give it intradermally under the skin like a TB test. So that allows us to save doses to be able to make it go further. And I talked briefly about bioterror and bioerror because a release of something can happen either intentionally or unintentionally. And that's what I mean by bioerror. So those are things that if a case of this pops up, we are going to be highly alert. There's a lot to do with that, even though it can be totally not caused by anything. We've seen cases of anthrax and botulism and plague and tularemia, and none of them are associated with bioterror. So, anthrax is naturally, not naturally occurring, but it's occurring in the soil. It's almost ubiquitous in some soil, and tularemia is around and it periodically pops up its head. But if they are weaponized, they can be obviously much more concerning. So I just want to end with something like how vulnerable are we in the U.S. Right now? And it's something that, public health, we think about this a lot. And what is really concerning to me about COVID is that a large part of the U.S. population just refused to do any COVID mitigation strategies, even though we were extremely lucky to have access to this in the United States when other parts of the world would, really, really appreciate that and need that. But it concerns me that what if we had something that was a biologic attack of some sort of biologic agent that has been released? That concerns me, that bad actors in other parts of the world now know that a large part of the United States simply would not listen to public health community, and I'm talking about World Health Organization, CDC on down, wouldn't listen to that, and that makes us, in my opinion, much more vulnerable. And that is the end of my little presentation here. So I have my email on here. I always welcome questions from people. I am the luckiest person to have this job in this community. It is an amazing community to work in. I have never seen so much cooperation and interest in public health, and it's wonderful. So I see my phone number's on there wrong too. My phone number is 531-5369, not 7. You can tell I make my own slides. So I don't proof them well. So I'm available if anyone has any questions. I will have Patrick ask them.
Yeah, thank you very much, Julie. I really appreciate, I learned a ton there, in just a very short amount of time, a lot of really good things. Also some things that, I didn't know about, a nice little fun fact of having the only cowpox case in North America, here. When you mentioned that the original monkeypox outbreak in 2003, I also didn't know that pet prairie dogs were a thing. So that's,
Nope.
I guess that's out there. And, also, thanks. Like you said, I probably won't be able to sleep tonight. I didn't know that about the bats, and their small bites and that sort of thing. So I'm gonna have to go check all corners of the bedroom and our
Very,
kids'
very
bedrooms as
treatable.
well. Yeah.
Yeah. If you find a bat, call someone to come get the bat for you. Call animal control, get the bat out of there. Public health will get it. We'll pick it up. We'll get it tested and then hopefully prevent any problems.
Okay. Got time here for maybe just a few questions. I don't want to take up too much time, but if you have any questions, put those down in the comment section. We can answer those here at the end. Just to start off, Julie, for me, I'm always interested to see what motivates folks to get into their line of work. So were you always did you grow up, as a child, always interested in getting into healthcare or public health or that sort of thing? Or what motivated you to get into this field initially, if you mind me asking?
Well, it was HIV/AIDS. So what happened is I was always a little bit of a science nerd. I loved I loved everything about animals, environment, science as a kid. But I was actually a commercial artist. And when HIV/AIDS happened and I saw how people were being treated in the news, and I was just horrified by that. And I thought I could do that. That isn't scary. Why are they treating people like that? And long story short, I just quit working in advertising. I came to the U of I. I said to them, I want to work with people that have AIDS. They shuffled me around till I got to the School of Social Work. And the School of Social Work hooked me up with Champaign-Urbana Public Health District, where I worked with Joan Lathrop. And she was the only one that was doing anything with HIV/AIDS, her and a group with GCAP, a Greater Community AIDS Project. And that's how it happened. And by all of my work as somebody who knew nothing about infectious diseases, just trying to learn about HIV/AIDS in a way that I could communicate it to others locally led me to, learning about all the opportunistic infections people get. And then I just became fascinated with it, and I was pulled in, and I've loved every single minute of it.
That's awesome. Yeah. And it's there's so many different, things, with our local public health district that I was unaware of that you all, deal with on a day-to-day basis and offer to the community, and I learned a whole bunch, tonight just for that as well. So it looks like, I'm sure that there is never an identical day on the job for you. So that always makes things.
That is what I love about it.
Yeah. Yeah. Okay. Susan asked a question, I think potentially referencing COVID-19. How do you address the people who believe in herd immunity for themselves or their children? If you have an answer to that one, Julie.
Well, I mean, I always just try to get as much information out there as possible. And I just try to make myself available to talk to individuals. And if they're not comfortable talking with me, in this amazing community, I can hook them up with an infectious disease person, if that's their question, a pediatrician. I mean, we have so many people in this community. We, U of I virologists, we have epidemiologists, we have with the university here, we have all kinds of things. But the key, I think, is just to let people know that we really do, care. People who work in public health, we really do care, and we want to see people happy, healthy, and safe, basically. And if there's something that we can do to that, to help with that, we're just going to keep doing it. We're all about prevention. We're never going to make everybody understand or want to be vaccinated, but we need to just keep putting out correct information and trying to explain, just be transparent and explain how we do things and why we do things. You all got to see how the sausage was made during COVID, because normally, we haven't really had that in my lifetime where well, that's not true. We did with HIV. But you don't usually see something that just pops on the scene, that there is really no template there, to work with. So what you have to do is you work with what you have before. And we just tried, all through the pandemic, I just tried to let people know that, we're here. We're ready to answer any question or get the answer for them, because we certainly don't know all the answers, and just to keep trying to explain, what it is we do, why we do it. But we really do want to see happier, healthier communities. And so when that's kind of your goal, and that's a pretty good goal, it's a pretty good thing. We have a great mission here, and the people that work here buy into that mission. That's what we do, and it just becomes public health. Kind of gets in your system, and so.
Okay. Well, thanks for that, Julie. I have another question. As we're, living through, the COVID-19 pandemic still, and, you've lived through it in a pretty unique perspective as administrator of a local public health district, and worked through, many of these other outbreaks and, epidemics and pandemics in your work and in public health. Is there anything, if you could, pick one or maybe a few, things that we've learned from current pandemic that you hope are applied to the future? In doing this exhibit at the Museum of the Grand Prairie, we look at, these previous outbreaks, epidemics, and pandemics, and what worked or maybe what didn't work, a long time ago. And as you said, we kind of, learn from what happens before and then apply that to the future. Do you have any things?
I absolutely do. It is my hope and my wish that we learn from COVID. We're already preparing for the next pandemic that I hope is long down the road, but public health can only do so much. We have the same tools have been being used. Epidemiology has been being used since John Snow took the pump handle off of the well, in London. So we have our tools, but what we have to have, if we're ever going to stop seeing these pandemics, is we need people to understand the One Health concept of human health, animal, it's a triad: human health, animal health, environmental health. They are all tied together, and they absolutely impact each other. And we have got to start dealing with inequity, because inequity and poverty, those are the things that will forever keep pandemics, epidemics, everything from being far worse than they need to be. So if we have learned anything, we should be able to, we all lived it. We could see that some people, made billions of dollars during the pandemic, and others were struggling to eat. So I always like to use this quote from Bill Fogue, who used to work for the CDC. It is that public health, social justice, is the foundation of public health. While epidemiology may be our scientific base, it's really social justice that is our philosophical base. If we do not continue to address issues of inequality, not just here, worldwide, we are going to just continue to see all of these diseases and all of these problems made far, far worse.
Thank you, Julie. Really appreciate the answer, and I right there with you as well. So thank you. Looks like we're not getting any more questions coming in at this moment, but we are getting some thank yous. You know, Paul says thank you, Julie. Susan also says thank you. Paul says excellent points here. So, you know, I would agree with all of those. And, you know, with that, it's getting close to 8 o'clock here. We'll wrap it up. So I want to thank you, Julie, again for joining us tonight, providing an excellent presentation with a lot of content, a lot of information, and then also just thank you for everything that you do for the community here, you know, here in the CU area. And, you know, especially we appreciate your support at the Museum of the Grand Prairie with our, you know, recent exhibit.
Everybody get out there and see that exhibit. It's fabulous. You guys did an amazing job. And thank you for the opportunity to present tonight. It was certainly my pleasure.
Yeah, and thanks to Julie and you know other community organizations like CUPHD. We couldn't have done the exhibit without them, and we have such a great community here, as Julie mentioned several times in her presentation. So with that, you know, I'll thank all the viewers out there, whether you're watching this live or potentially recorded. Thanks for tuning in tonight. Hope we can see you at some of our future virtual or in-person programs, or just coming out to the museum. As Julie said, check out our new exhibit and other spaces. So with that, good night, everybody. And until next time, going to end the live broadcast.
Good night.